This is a very special center. Tell us about what's going on here at Trinity Spine.
What's going on here is a state-of-the-art lab was built that has the highest levels of containment and sterility. And what we're doing here is taking a patient's marrow and isolating the stem cells from that marrow, concentrating those, and then with a technique where we bind those cells to a specific FDA-approved biocarrier, biomaterial carrier, we can then re-inject them and have them locally, locally enhance spine disc disease.
When you say you separate the stem cells, is that a process of by adding a liquid to it? How do you do that?
We do that by a series of different centrifications because the stem cells are separated from the rest of the bone marrow blood. And they're actually a lower number of total cells in the bone marrow. So we isolate those, and within that particular layer where the stem cells reside, there are also white blood cells. So we want to then try and bind the stem cells away from the white blood cells and have a more purified preparation of stem cells for the patient.
The machine, the large machine over here on the wall, describe that. What is it? What does it do?
That's the centrifuge, and that's where we spin the cells at different G forces to sediment out the cells that we want.
What type of liquids do you add to those tubes?
We add different medias, which are isotonic. In other words, the cells respond to them in a way that's neutral so that they don't explode or die. So and then we also provide a minimal amount of nutrients to allow the cells to live for a period of time in culture until they're re-injected into the patient.
How do you store them?
They're stored in two ways. If a patient is coming in for a second his injection in a short period of time, those are stored at body temperature under 5% CO2 in the environment so that there's a buffering system with bicarbonate that we use. And in addition, we store a certain number of those cells in a cryogenic freezer so that if the patient needs an additional injection or if something happens, for instance, we have an additional backup.
What's the maximum time you could store a stem cell?
In cryogenic, for pretty much forever, as long it's minus 145 to minus 150 degrees Celsius. So it's very, very cold. We use a cryopreservative to keep them alive. The viability is very good, even for 10 years, for instance. It would be very effective.
When someone goes through the process of stem cell therapy and treatment, what's the rate of success for these patients?
The rate of success has been in the high 80s, 80% or more usually are responders. There's always people who, again, for genetic reasons and other variables are not responders, but there's a very high incidence of success in using stem cells.
What makes this center so special when it comes to stem cell therapy? Is it unique?
It is unique. It's one of the few, if only the only place in the country that allows patients to come in and have the kind of procedures that are done here available to them. It's unique in that regard.
Dr. Grande, does somebody have to have a back problem in order to come here and get their stem cells stored?
No, actually, any person who has, and actually the uniqueness of the facility, it lies in the fact that we do have the ability to isolate stem cells from individuals for a multitude and a range of various maladies, including other orthopedic injuries such as cartilage defects, rotator cuff repair, and actually vascular pathologies as well. So the idea is that a patient can come here and have their stem cells harvested, isolated, purified here, stored for future use whenever they need it. And as you know, as you get older, those stem cells become less. So it's not a bad investment for your own health to have those cells stored.
Now you mentioned the word purified. That's something different and unique that you guys do here as
Correct,
well.
correct. So we isolate not only the buffy coat, which has both the white blood cells and the stem cells. We attempt to harvest and further purify that layer and isolate only the actual marrow stromal cells, the mesenchymal stem cells.
Okay. Once you harvest these cells and purify them and you re-inject them into someone, how soon do they see a relief in pain or improvements?
Patient would typically, in our preclinical studies, we've seen, for instance, disc height and disc volume restored within 4 to 6 weeks. Pain vis-a-vis the various inflammatory mediators start to decrease almost immediately and clinically within 2 weeks.
Right-handed people live on average 9 years longer than left-handed people. More Health Matters is on the way.